To get back into bed, you will back up to the bed so that both legs are touching the bed. Straighten your surgical leg out in front of you. Reach back to the surface slowly, lower yourself with your non-operative leg while reaching back for the bed. You will then scoot yourself back in bed and lift your legs into the bed. To get out of bed, you will walk your legs towards the edge of the bed and reverse the process. Once in sitting, you will scoot towards the edge of the bed until both feet are touching the ground, and stand up using your non-operative leg and as much as your operative leg as you can by pushing up with your arms from the bed surface. To get into bed, if having too much pain or difficulty lifting your surgical leg, you may use your non-surgical leg to hook under the foot of your surgical leg and assist it into bed. This process is reversed when getting out of bed, so you may use your non-surgical leg, hook it under your surgical foot to assist it in getting out of bed. Another option of having difficulty moving your surgical limb is to use an assistive device. You may hook this device around your foot prior to getting into bed. Give a gentle pull on the device to help lift your surgical limb in and out of bed. Again, you will get this assistive device around your surgical foot. You may move your legs to the edge of the bed, giving a gentle pull on the assistive device to help move your legs over the edge of the bed.